So I have a fellowship training in urinary incontinence, voiding dysfunction, peeing dysfunction, pelvic organ reconstruction, and genital reconstruction as well. Urinary incontinence is something I find very enjoyable to treat, but also to talk about, if that's fair to say. I do understand that it's a very potentially embarrassing to talk about, but it's a very common problem that is very prevalent in the population, especially as the population ages. My role is to provide information regarding incontinence, things that patients can potentially do to alleviate some of the problems, whether it just be lifestyle changes, diet changes, or habit changes. And there are all sorts of therapies, whether it be medications to surgery, if those conservative things fail. Because it is a quality of life issue could be potentially very burdensome to patients, I am not here to push you. I am just here to provide information, and you make the ultimate choice in terms of what you want to do about the urinary incontinence. Being obese, we know, is a strong factor in urinary incontinence, and there's been randomized studies that have shown that if you could lose 10% of your body weight, incontinence episodes could decrease by 50%, which is a huge number that we can hang our hat on. But unfortunately, we understand that weight loss is a thing that's much easier said than done. Others are, we know there's certain things that can exacerbate urinary incontinence. So we'll generally ask about alcohol intake, smoking history, caffeine intake, and constipation, things of that sort. Those are very potentially correctable things that do not require any medication with its potential drawbacks or surgery with its potential drawbacks either. If you come to me with urinary incontinence, we'll figure out what type of urinary incontinence you have, what you've tried before, whether it be lifestyle change or medication, and we'll generally go very conservative first, whether that just be lifestyle modification, whether it be any behavior modification. We have some great physical therapists who specialize in pelvic health, which we've worked with a lot, and we usually try to go through those routes first, and only if they fail do we proceed up the route of medication or surgery, because obviously since this is a quality of life issue, if we could do it without any of the drawbacks of medication or surgery, that would be a plus for the patient, but also for us. When I do see a patient with urinary incontinence, I'll generally go through all the modalities from conservative all the way to surgery. And the reason I do that is because obviously it's a very embarrassing problem. They may have been dealing with this for a very long time. And I don't want them to leave thinking that, oh, I've tried the weight loss, I've tried, quitting smoking, I've tried, cutting back on certain inciting factors, and it's not working, and that's it. I'm not going to see me again. I go through the long list, including surgical options, because I want them to know that there's a lot of options available, and that I'm here to kind of see how they do at each step of the way, and whatever I can provide for them along the way as well.